Hello student, I am Professor Devashish Bose, Head Department of Criminology and Forensic Science, Dr. Hari Singh Gaur Vishwavidyalaya, Sagar, Madhya Pradesh. Today I am going to present a lecture of BSc 5th semester on the unit Examination of Drug Part 2, which has been jointly prepared by myself and Ms. Neha Sharma, PhD scholar, a UGC JRF at Department of Criminology and Forensic Science, Dr. Hari Singh Gaur Vishwavidyalaya, Sagar. Let's start our discussion while taking a look at what we are going to learn today. Today in Module 1, we will look at the introduction of opium. Module 2 will discuss about mechanism of action and metabolism of opium. Module 3 will be dedicated to acute and chronic poisoning. Module 4 will be cause of death. Module 5, what will be the post-mortem appearance, followed by the last module, that is Module 6, conclusion. My dear student, opium is generally known as opium. Opium is the milky elude obtained by incising the unripe seed capsule of the poppy plant, Papaver somniferum. This is cultivated in India and other neighboring countries only under a license. The plant grows up to 1 meter in height. Each plant bears 5 to 8 capsules. Flowers are very beautiful and colored. The unripe capsule is incised and the white juice excludes it, collected and allowed to evaporate to obtain opium. I think you have all seen the opium plant. Ripe and dry poppy capsule contain a trace of opium and are used for the sedative and narcotic action. Their warm decoction is used locally as a sedative. Poppy seeds are white, harmless, demulcent and nutritive and are used in food you have seen in the household kitchen, and we use it daily. The oil from the seed is used for cooking purposes also. Opium occurs in rounded, irregular form and flattened mass and has a strong characteristic odor and bitter taste. When fresh, it is very soft, flexible and internally moist, coarse, granular or smooth and reddish brown on keeping. Crude opium contains a large number of combined with meconic, lactic and sulfuric acid. The pharmacological active alkaloids of opium are divided chemically into two groups, the phenanthrene group and the benzoyl isoquinol group. Phenanthrene series of morphine contains 9 to 14%. Codeine content is 0.5 to 2%. Thebaine is 0.2 to 1%. Benzoyl isoquinol series. Papaverine 0.8 to 1%. Noscapine 3 to 10%. Narcine 0.2 to 4%. You know, my dear student, the main alkaloid of opium is morphine. That is the most potent alkaloid present there. Pharmacologically, it acts on central nervous system. The chemical formula is very simple, C17H19O3N. The morphine is named after a Greek god, Morpheus, who is considered as a god of dreams, because if you take morphine, people say you reach the state of dream. It occurs as a white powder or white shining crystal with bitter taste and alkaline reaction. Morphine has depressive effect on cerebral cortex, respiratory system and depresses cough reflex. The vomiting center and the vagus are stimulated. Morphine causes stimulation of spinal cord. Morphine causes analgesia due to depression of pain, precipitation and its euphoric effect. In the year 1806, Friedrich Wilhelm Adam Steiner, a German pharmacist, assistant isolated morphine for the first time. It appeared to be a nitrogen-containing base, which was revolutionary as it was thought at the time that all organic substances were acids. The hunt was on for other alkaloids such as strychnine, which was discovered in the year 1877, caffeine in the year 1820, nicotine in the year 1829, codeine in the year 1832, thebaine in the year 1835 and papaverine in the year 1848. Since the isolation of morphine by Steiner, 44 alkaloids have been isolated from the opium poppy. Isolation of the most important constituent of opium thereafter made it possible to administer an accurate dosage. The opium, opiates and opioids are different. The term opiates refer to the products obtained from the opium poppy. The term opioid is used to denote all naturally occurring semi-synthetic and synthetic drugs which have morphine-like action, like relief from pain and depression of CNS. Previously, these drugs were called as narcotic analgesic because some of them induce sleep. Now, narcotic term is used to drugs that are capable of producing dependence. Opium and its derivative are classified as natural. These are directly extracted from the plant. Example, morphine, codeine, etc. Semi-synthetic. They are made by the chemical reaction of the plant extract with some of the chemical. Example, heroin, hydromorphine, oxymorphine. Synthetic. These are purely made in the laboratory by using chemicals. Example, methadone, phenyl, etc. The opioid drugs produce their effect by combining with opioid receptor, which are widely distributed in the central nervous system and other tissues. Opioid receptors are mu, delta or kappa located at spinal and supraspinal sites in central nervous system. Opioid receptors are a part of family of G protein coupled receptor and act to open potassium channel and prevent the opening of voltage calcium channel, which reduces neuronal excitability and inhibits the release of pain neurotransmitters. The mu receptors are important and two subtypes are recognized. The mu1 receptors are associated with analgesia, euphoria and dependence, whereas mu2 receptors are associated with respiratory depression and inhibition of gut mobility. Similarly, the opioid antagonist naloxone and naltrexone show a high sensitivity for mu receptors. Kappa receptors are responsible for analgesia at the level of spinal cord. Opiates exert their effect because of their chemical similarity to natural substance called endorphins. The opioid drugs activate receptor sites normally occupied by the natural opiates or endorphins. Opium depresses all centers except oculomotor, vomiting and sweating. It is a peripherally acting analgesic. It stimulates non-propulsive rhythmic contraction of small intestine. Opium and its derivative act synergistically with alcohol and barbiturates. After studying the action of the opium, we will go through the metabolism of this drug. Metabolism. Metabolism refers to the process of biotransformation by which drugs are broken down so that they can be eliminated by the body. Some drugs perform their function and then are excreted from the intact, but many require metabolism to enable them to reach their target site in an appropriate amount of time. Remaining, there are adequate time and then be eliminated from the body. Altered metabolism can result in an opioid or metabolite leaving the body too rapidly, not reaching its therapeutic target, or staying in the body too long and producing toxic effects. Opioid metabolism results in the production of both inactive and active metabolites. In fact, active metabolites may be more potent than the parent compound. Thus, although metabolism is ultimately a process of detoxification, it produces immediate products that may have clinically useful activity, be associated with toxicity or both. Opioids differ with respect to the means by which they are metabolized, and patients differ in their ability to metabolize individual opiates. However, several general patterns of metabolism can be discerned. Most opioids undergo extensive first-pass metabolism in the liver before entering the systemic circulation. First-pass metabolism reduces the bioavailability of the opioids. Opioids are typically lipophilic, which allows them to cross cell membranes to reach target tissue. Drug metabolism is ultimately intended to make a drug hydrophilic to facilitate its excretion in the urine. Opioid metabolism takes place primarily in the liver, which produces enzymes for this purpose. These enzymes promote two forms of metabolism: phase 1 metabolism, modification reaction, and phase 2 metabolism, conjunction reaction. The unchanged and unconjugated morphine are excreted by the colon and by the kidneys. A small amount is excreted through milk also. With this, we come to the end of module 2. Acute poisoning. Signs and symptoms. The contact of morphine with the skin of sensitive person may cause erythema, euthanasia, and itching dermatitis. When opium is taken by mouth or orally, symptoms begin within half hour. If the drug is ingested, its action is noted within 3 or 4 minutes. It first stimulates, then depresses, and finally paralyzes the nerve system. The symptoms can be divided into 3 stages. Stage of excitement. This stage is of short duration and may be absent if a large dose is taken. There is an increased sense of well-being, increased mental activity, freedom from anxiety, talkativeness, restlessness, or even hallucination, flushing of face, and greatly excited or menacing condition may be seen. In this stage, the stage is short. The person feels better with increased sense of well-being, talkativeness, restlessness, or hallucination, flushing of face. Next, we come to stage of stupor. The symptoms of this stage are headache, nausea, vomiting, incapacity for exertion, a sense of weight in the limbs, giddiness, and drowsiness. The subject lies motionless with eyes closed as if in a sound sleep from which he may be aroused at first, but soon passes into stupor and coma. The pupils are contracted, face and lips are cyanosed, and an itching sensation is felt all over the skin. The pulse and respiration are normal. In this stage, headache, nausea and vomiting, giddiness, drowsiness, meiosis, stupor. With this, we come to the next stage, stage of coma. In this stage, the patient passes into deep coma from which he cannot be roused. The muscles become flaccid and relaxed, and all reflexes are abolished. The face is pale and conjunctiva congested. The pupils are contracted to pinpoint size and do not react to light but dilate during the agonal asphyxial phase caused by respiratory depression, and ultimate is the paralysis. All the secretions are suspended except sweat. The skin is cold and often covered with perspiration. Temperature is subnormal, blood pressure is low, the pulse is slow and full, the breathing is slow and stertorous and may be reduced to 3 to 4 per minute. The odor of opium may be present in the breath. In this stage, the patient passes into deep coma, muscles become flaccid, hypothermia, hypotension, bradycardia, bradydyspnea, non-cardiogenic pulmonary edema, convulsion, respiratory depression, death. In case of fatal termination, lividity of the surface increases, pulse becomes slow, irregular and imperceptible. The respiration becomes chain stroke in type, and finally death occurs in deep coma from asphyxia. The skin blistering is seen depending on parts of victim of deep coma is due to continuous edema caused by cessation of venous return from muscle flaccidity. Chronic poisoning. The mechanism of tolerance is not known, but it is thought to reduce at a cellular level. The habit is acquired by young people as it is believed to be an aphrodisiac and as it produces a sense of euphoria. Opium addicts can tolerate 3 to 6 grams per day. The morphine addict has a dry skin and shows scars of healed abscesses or abscesses themselves and sometimes tattooing from needles. The habitual use first causes a pleasurable feeling of relief and well-being, but at larger dose are taken, there is disinterest and recurring periods of depression follows. The patient becomes restless and irritable, and sleep is disturbed by dreams or there is insomnia. Loss of memory, mental fatigue, and gradual intellectual and moral deterioration occurs. Hallucination may occur. Constipation, contracted pupil, anorexia, emaciation, and weakness and impotence are frequent. Sudden cessation of opioid used in dependent pregnant women may be life-threatening to the fetus. Long-term use of opium drug increases a person's death risk by almost twice as much as any other cause, including heart disease, respiratory conditions, and cancer. Death may happen due to renal failure, heart failure, or due to brain damage. The fatal dose and period may vary is to use and under mention is as approximation. Fatal dose: opium 2 grams, morphine 0.2 gram, codeine 0.5 gram, methadone 0.1 gram, pethidine 1 gram. Fatal period is around 6 to 12 hours, but it depends on case to case. Treatment: opium poisoning can be treated in following ways. If taking orally, gastric lavage, it should be immediately be done first with water. Sample of gastric lavage must be preserved. Later, the stomach wash can be done with a solution of potassium permanganate, which converts opium and its alkaloid into harmless compound by oxidation. It converts morphine into oxydimorphine. Even in case where morphine is given by any route other than oral, gastric lavage should be done as morphine is re-excreted into stomach. Antidote: once it is confirmed that the person has taken opioid, naloxone in dose of 0.4 to 1.2 milligram should be given intravenously at once. The person should be observed for next 3 minutes. If there is a change in the size of pupils, respiratory rate, and level of consciousness, it is a positive sign. If a positive response does not occur, 1.2 to 2 milligram of naloxone should be given every 3 to 5 minutes till a response occurs or the dose reaches about 4 to 10 milligram. The naloxone has a half-life of 1 hour, so it has to be given continuously. If required, intravenous infusion can be given. Ethylene hydrochloride and methadone are morphine-like compounds and require same treatment. Body temperature: the body temperature should be maintained by warm blankets. Hypotension should be treated with fluids. The patient should be monitored for late deterioration. Once opium is taken in high dose and the person dies, what happens inside the body? Body may be emaciated, dirty, and shows sign of infection, especially in the form of ulceration. Although clinically constricted pupils are characteristic, but after death, any kind of pupil alteration may occur. Froth may be exuding from mouth and nostrils due to pulmonary edema. Injection marks may be found commonly on the arms, classically in the antecubital fossa or the front of the elbow, or into some of the prominent veins on the forearm or dorsum of the hand, usually left side, as majority are right-handed, but in habitual users, sclerosis of veins may occur, so hands may be used randomly. Veins of dorsum of the foot may be used due to thrombosis and scarring in hands and arms. Take keen observation because old injection marks may sometime be associated with bruises. Veins may show overlying fibrosis when phlebitis has occurred, or old venous thrombosis with firm cord-like vessels under the skin. Subcutaneous injections commonly on thighs and abdominal walls lead to area of subcutaneous sclerosis, fat necrosis, and abscesses, and deep skin popping. Deeper injection into muscles can cause chronic myosis. We can summarize autopsy finding as follows. signs of asphyxia, froth at mouth and nostril, smell of opiate may be present, injection marks, skin abscesses, scarring is addicts, emaciation, pulmonary edema, cerebral edema. As a forensic point of view follows, samples should be collected. The main samples to be collected are blood, urine. These are important also in case of live people, brain, stomach and its content, liver, vitreous humor, kidney, cerebrospinal fluid, bile, dry saps from each nostril if taken by nasal routes. This can also be used in live patient. Opium has been used for thousands of years by human beings as an analgesic, antidiarrheal and anti-stomach ache agent, and as a mean for committing murders and suicide also. It is also widely used for calming babies. It had great military importance as a painkiller for casualties on the battlefield. Opium can be eaten or drunk as a opium tincture. Smoking of opium arose later, after the popularization of tobacco as a stimulant. Metabolites of opium are more harmful than crude opium. The opium poppy is indigenous to many climates. It also grows wild in many areas, but the largest quantities come from three main areas of the world, the areas known as Golden Triangle, that is Laos, Burma and Thailand, Burma now known as Myanmar, and the Golden Crescent, that is Afghanistan, Pakistan, Iran, and to some extent Mexico. Legally allowing to produce opium is given by United Nations Single Convention on Narcotic Drugs under supervision by the law enforcement agencies of individual countries. In India, opium was collected by farmers who were licensed to grow opium poppy. This price of opium paste is fixed by the government according to the quantity and quality tendered. By the farmers, some amount of money is made by drying poppy heads to collect seeds. Some farmers also divert small fraction of the crude opium to the black market, from where they earn huge amount of money. Black marketeers convert opium into derivatives like heroin to earn more money and selling it to illegal drug peddlers. Addicts administer opium derivatives through intravenous injection, while opium is taken traditionally through opium pipe and now by using electronic gadgets. Overall, we can say selective breeding of opium increased the phenanthrene group of alkaloid morphine, codeine and thebaine. Illegal production of opium is carried out to convert it into highly potent drug like heroin, which can be injected, snorted or smoked. Opium is a Schedule II drugs under the Controlled Substance Act 1970 of United States of America, while most opiates are Schedule II, III, IV and V drugs. According to this act, Schedule II drugs can be used for medicinal purpose with restriction and with written prescription only. Some drugs that are derived from opium such as heroin are Schedule I drug. So my dear student, with all these information here, we come to the end of today's lecture. Do keep in mind that what we have discussed today. It's time for you all to do some self-study on opium. This is Professor Devashish Bose signing off. If you want to learn more and enhance your knowledge, you may log out to our website for MCQ, quizzes, LORs at www.cec.nic.in. Till then, goodbye and thank you for having a patient listen.